I'm Dr. Carine of Carine Pediatrics. I know a lot of you are following this COVID-19 information very closely, and we have lots of information on our Facebook page, and I want to refer you there for more. The first thing that I want to tell you is that children are handling this disease very well. International data indicates that children are almost rarely ill enough to be hospitalized, and we have had no pediatric deaths internationally in children under 10. So this is really great news for us in pediatrics that our patients seem to fare this disease very well. The data is also very good for young adults and families and parents. The rate of serious illness is very low, and so I want you to feel confident that your family and your children are safe throughout this illness. We do believe a lot of the population will catch this virus over time, but you shouldn't be concerned about that for your safety and your children. If you wonder why the health department is taking such drastic measures in confinement and limiting events, is because it actually is a very dangerous disease for patients that are older, especially over the age of 60, or have serious medical conditions. And actually in that population, it's very serious. And the control measures they're taking is to limit how many of those patients become seriously ill and potentially die from this virus. I want you to take those recommendations from our health department seriously, and I want you to be confident that your children and your family should weather this very well, but also that the elderly members of our population really do need protected. I want to take that into account as we talk about grandparents and their access to our children, and we have been recommending to our patients that they really limit how much time their children and they themselves spend with their elderly family members right now, because children and adults can spread this virus for up to weeks with no symptoms at all. So just because you're feeling healthy and you feel like you're healthy to be out and about does not necessarily mean that you are safe to be around your elderly family members. If you need more guidance about that, there's more information at the health department, and I want to reiterate that you can follow their news on that and the CDC schedule. We here at Carine Pediatrics will continue to serve your family in all the ways that you need us for. Well checks, medication checks, broken legs, silly things children do, and those things are very important for us to keep moving here because we need to be available for you to serve your families. As illness comes in, what I want to be careful that we communicate is you do not need to bring your children in just for fever or illness if they are not otherwise compromised. I know everyone's worried and they want to be tested. We still have some limitations on our testing ability, and when that changes, we'll let you know. For right now, our current recommendations are that if your child has a fever, that is a fever alone with no other symptoms for less than 3 days, just keep them home, keep them hydrated, use very limited fever reducers because fever is an important part of this virus, and just keep them isolated. They do not need to come to the office. When do they need to come to the office? Well, if their breathing is labored, if they're having trouble eating, if they're coughing so much they're vomiting or having trouble eating or drinking because they're coughing so hard, if they look dehydrated, or if they have fevers that last more than 4 days. These are things we would want you to come in. Of course, if they're having pain and you wonder if they have an ear infection or they look like they're ill in other ways, then contact our staff and we'll make those decisions. What about if your child has a cough but doesn't seem seriously ill? Do you need to come to the office or should you restrict your access? We are putting those children in a separate entrance away from our healthy patients, and if possible, it's better to leave a child who's coughing at home, even if they seem pretty well aside from their small amount of cough, because children take this illness so well that we don't know exactly which of those kids are going to be sick enough to be transmitting COVID. If your child has a well child appointment and happens to be coughing, just let our staff know and come through the sick door and we will continue to see them. If one of your children has a visit and the other child is sick, we would prefer that you leave the sick child at home. However, if you need to, same precautions, let our staff know that that child is sick and we'll room them in a different room. If you have more questions, we're going to post some more information on our website and our staff will be available. Keep in mind that we may have some very set forth guidelines for you and we'll refer you back to those. And then if you have more questions after those set guidelines, then our staff will be totally ready for you. I hope this answers your questions for today, and be well and keep your family safe. Thanks.